Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, February 2nd, giving you the update from Albany Med. All right, it's Groundhog Day.
It is Groundhog Day.
It feels like Groundhog Day.
Yes.
For sure. All right, two things. Number one, did the groundhog see his shadow?
Yes, he did.
So 6 more weeks
of winter. Yeah.
Second of all, the movie Groundhog Day.
Yes.
Do you know how long Bill Murray spent in Punxsutawney in the movie?
I don't.
It's estimated to be 40 years.
40 years.
Yeah, so that's what Harold Ramis says. 40 years he was in Punxsutawney.
Okay.
So there you go.
I'll remember that useless fact.
I think it's a great fact. All right. Capital Region numbers, 8 counties admitted to the hospital with COVID. You can see on that chart we are down. Great news. It was as high as 553. Today it's 416, and it's falling pretty fast.
It's falling very rapidly, yes.
Which is great news. Next chart there is admissions and discharges here to the medical center. As mentioned last week, this is the full run chart. So this goes back really to March of 2020, and it gives perspective of the first bump and then down.
That's right, Dennis.
And the second run here. So let's pull up the third chart here. This is the morning census here at the medical center. Now, Fred, again, at one point we had as many as 155 in the hospital.
That's right.
Today that number is 120, 26 in the ICU and 8 on vents.
That's right. And Dennis, when we had 155 in-house, the vast majority of them were acutely ill.
Right.
Today, of the 120, 37 of them, I think, are positive for COVID, but not infectious.
So let's talk about that, Fred. A couple people emailed us after we've mentioned that in the past, we're looking for some clarification. Let's break it down 2 different ways. The first one is this. When you do a test for COVID with the nasal swab, and we do what's called a PCR test, how is it that the virus could be dead, but yet still detectable in the nose?
So the PCR test measures a piece of the RNA.
Okay.
So it measures a piece of the genetic material. That could be in a live virus, it could be in a dead virus, it could just be a fragment.
Okay.
It doesn't matter.
So you could still have it, the remnants of it in your nose and test positive.
Correct.
So then the next question, of course, is, all right, if you test positive for COVID in the hospital, how do we distinguish between those who are still infectious versus those who are not?
So Dennis, we follow the CDC guidelines. So there's a period of time, 10 days after your symptoms have gone away, that we would deem you not infectious. If you're immunocompromised or in other kinds of circumstances like that, we would wait 20 days to make sure you're not infectious.
And again, of those 120 in the hospital that are testing positive, what number are fall into the category of no longer infectious?
And today, again, I think that number is 37 today.
And in that 37, we have some who are still being treated for other medical conditions.
Correct.
And some where we just can't send them back to the facility from which they came.
Correct.
Right.
That's absolutely true.
All right, well, very good. Hopefully we answered those questions to the satisfaction of the people who sent them in. And if there's any other questions like that, let us know.
Yes, please ask us.
Let's talk about another number here, which is vaccination of our staff. So if you don't mind, we'll pop the graph up there on the screen there. And Fred, we could talk about this. So this is a graph done by our own Michael Hauk.
Yes.
Right? Our analytics department is fantastic, Michael being one of the many who do that great work. If you look on the horizontal axis, this is days going back to the middle of December. That's when we started the vaccinations. And on the vertical axis, it looks at 7-day positive case average. And what this looks at is the population of people who have been fully vaccinated, those who've received 1 dose of either of the vaccines, one that's received 2 doses, and then the overall. And Fred, let's start by looking at this here. If you look at the green graph, those are the people who've been fully vaccinated. Obviously, we didn't have some of our staff fully vaccinated till a month after we started. So middle of January, what does that graph show you?
So Dennis, if you look at January 12th, on the green line, somewhere around 1 case on average positive for all those staff that were tested that are fully vaccinated. And then as you trail that green line across, it becomes 0 around the 24th.
So let me ask you a question. If I've gotten my 2nd dose of either vaccine, on the day I get it, am I fully immunized?
No, Dennis. In the studies that looked at the efficacy of the vaccines,
Right.
they looked 2 weeks out from your last dose.
So it appears as though the group that's been fully vaccinated has, for all intents and purposes, gone down very close to zero most days.
And particularly when you get to that 2-week out
Right.
period from the first time somebody was fully vaccinated.
Go ahead.
The blue line are those that have just received 1 dose.
Yes.
And you can see that, again, if you look at the beginning of January, it was about 7.5%,
Right.
7-day average, or 7.5 cases, I should say. But that line, too, has dropped down, and as you get out to the end of the month,
Yes.
now it's 0 as well.
Which is great.
That's right.
And then there's the red line, which are those who have received neither of the vaccines or either dose yet. And that number still remains higher than the other groups.
That's right. And Dennis, it really kind of matches the community positivity rate, which I think yesterday was 4%. The red line here looks to be about 3%.
All right, very good. And I know that last Friday we had another 380 or so of our workforce who got their first dose vaccine, which I think now puts us right at or right above 90%.
I think that's right, Dennis.
Incredible.
And our second dose population is around 70%, and that's rising as well.
Great. As everybody knows, it snowed yesterday. Let me begin by saying that we always know that our workforce, everybody who works here, is essential. We've proven that over the last year. On a snow day like yesterday, they still get up, they come into work, they take care of the mission. So thank you to all those who showed up as well. Fred, a question came from somebody who said, I was scheduled for my second vaccine yesterday and I couldn't get to the clinic to get my shot because of the snow. Have I missed the window? Am I now not eligible to get my second shot?
The answer to that question, Dennis, is no, you've not missed the window. The window for Moderna is 26 days after your first shot to 36 days.
Excellent.
So it's a pretty wide window, and similar for the Pfizer vaccine. So you just need to reschedule and get that shot.
So if you missed it for whatever reason, snow or otherwise, call and get rescheduled. You still have time to get that
That's
second
right.
shot. And as we've seen from the graph, it's important to get the
It
second
makes a
shot.
difference.
Fred, we talked in the past about the post-COVID clinic. There's a lot of organ systems that can be affected if somebody gets COVID, lungs being obviously one of them. We have a clinic set up here where we take patients who are no longer in the hospital and do a check on them after they've left. Dr. Tawari runs that.
And so we're going to actually have Dr. Tawari on Thursday to talk a little bit about that post-COVID clinic. As you said, Dennis, lots of different organ systems can be affected for a fair length of time after the initial infection. So we'll hear more about that on Thursday.
That should be exciting. Drove in this morning, just like you, Fred. It was dark. Pillars were red. Why are the pillars red this day, this week, this month?
So Dennis, it's Heart Month.
Yes, it is.
The American Heart Association every February declares Heart Month, and that's what's going on right now. You know, Dennis, we have a lot of firsts here when it comes to the heart here at the Medical Center. Our cardiac program actually started in 1950.
Incredible.
We've got a lot of firsts. We've done the first cardiac catheterization. We've performed the first open heart surgery. We've got the only pediatric cardiac surgery program. We have performed the first trans-aortic valve replacement.
Yes, TAVR.
So the TAVR, mitral valve clip, again,
Yes.
another first for us. So, you know, we've done a lot of very good things for our community when it comes to hearts and cardiac problems.
And of course, you're a cardiologist, and I know you're very involved with the American Heart Association. So
They do really good things for the community.
They do, and we're proud of our association with them. So the pillars are red, and we celebrate our role in cardiac care in this region, which leads us to our last point, which is we have a Daisy Award winner.
We do.
Katie Keenan, and we'll pop her picture up there. And Katie works on
D4 North.
D4 North, which
our
is
cardiac unit.
cardiac units.
Congratulations, Katie.
As we've mentioned in the past, this is a nurse that's recognized by patients through write-ups where they call out not only their skills as a nurse, but really the human side, the compassionate side, which we know that many of our nurses display on a regular basis. And Katie, of course, was recognized, so we thank her for that. And her unit gets the cinnamon buns.
Cinnamon buns, yep.
One of these days, we have to have them here.
I know.
All right, so we'll be back again on Thursday, and we'll look forward to talking to Dr. Tawari at that time.
That's right.
All right, very good. We'll see you in 2 days. We ask that you once again, please take care of yourself, take care of each other, and we'll see you on Thursday.